Chronic fatigue syndrome, also known as myalgic encephalomyelitis, is a complex and debilitating disorder characterized by profound fatigue that is not improved by bed rest and may be worsened by physical or mental activity. Patients often experience a spectrum of symptoms, including severe weariness, muscle pain, impaired memory or concentration, and sometimes symptoms of flu like conditions. Additionally, individuals may suffer from unrefreshing sleep, headaches, and extreme exhaustion lasting more than 24 hours after physical or mental exertion. While there is no cure for chronic fatigue syndrome, treatment strategies focus on symptom relief and management, encompassing a combination of medications, psychological counseling, and lifestyle modifications. Risk factors for developing chronic fatigue syndrome are still being studied, but may include viral infections, immune system problems, hormonal imbalances, and genetic predisposition. Here's a detailed look into various aspects of chronic fatigue syndrome, a condition that continues to challenge patients and healthcare providers alike. Symptoms and progression of chronic fatigue syndrome. Chronic fatigue syndrome, CFS, also known as myalgic encephalomyelitis, ME, presents with a hallmark symptom of persistent and unexplained fatigue not relieved by rest. This overwhelming tiredness significantly impairs daily functioning. Patients often report a range of additional symptoms, including muscle and joint pain, sore throat, headaches, and cognitive difficulties such as memory loss and concentration issues, a phenomenon often termed brain fog. CFS can also manifest in sleep abnormalities, either as insomnia or unrefreshing sleep. The disease follows a fluctuating course, with patients experiencing periods of relative wellness interspersed with episodes of intense symptoms known as crashes or flare-ups, often triggered by physical or mental exertion. The unpredictable progression of CFS makes it challenging to manage and can lead to long-term disability and a diminished quality of life. Diagnosis of chronic fatigue syndrome. Chronic fatigue syndrome, CFS, also known as myalgic encephalomyelitis, ME, presents a significant diagnostic challenge due to its elusive and subjective symptom profile. The diagnosis is principally reliant on patient history and the exclusion of other medical conditions with overlapping symptoms. A comprehensive evaluation typically includes a detailed medical history, physical examination, mental status assessment, and a series of laboratory tests to rule out other potential causes of fatigue, such as thyroid disorders, autoimmune diseases, or sleep disorders. The CDC criteria for CFS diagnosis emphasize the presence of unexplained, persistent, or relapsing chronic fatigue for more than 6 months, along with at least 4 out of 8 additional symptoms that include memory or concentration problems, sore throat, tender lymph nodes, muscle pain, multi-joint pain without swelling or redness, headaches of a new type or severity, unrefreshing sleep, and post-exertional malaise. Despite advances in understanding, no definitive biomarkers or imaging tests have been established, necessitating a diagnosis of exclusion that complicates patient care and necessitates a multidisciplinary approach. Cause and risk factor of chronic fatigue syndrome. Chronic fatigue syndrome, CFS, also known as myalgic encephalomyelitis, ME, is a complex disorder characterized by extreme fatigue that doesn't improve with rest and worsens with physical or mental activity. Despite extensive research, the exact cause of CFS remains unclear. However, several risk factors have been identified. It is believed that certain viral infections, such as Epstein-Barr virus and human herpes virus 6, could trigger CFS. Immune system dysfunction is another potential contributor, where the body's defenses against illness appear to be impaired. Hormonal imbalances, particularly in the hypothalamic pituitary adrenal axis, which regulates stress response, have also been implicated. Additionally, people who experience high levels of stress or have a genetic predisposition may be at increased risk. Environmental factors can play a role as well, though no clear-cut patterns have emerged. Overall, CFS likely arises from a combination of factors rather than a single cause, contributing to the challenge of diagnosis and treatment. Treatment and management of chronic fatigue syndrome. Treating chronic fatigue syndrome, CFS, involves a comprehensive approach, as no single therapy exists that works for everyone. Management begins with a thorough evaluation to exclude other causes of fatigue. Once CFS is diagnosed, treatment is personalized, typically including a combination of pharmacological and non pharmacological interventions. Medications may address symptoms such as pain, sleep disturbances, and depression, while graded exercise therapy, GEAT, and cognitive behavioral therapy, CBT, have shown effectiveness in improving function and coping strategies. Pacing activities to avoid overexertion is crucial, and nutritional adjustments may also support energy levels. Importantly, education on CFS and empathetic support from healthcare providers, family, and friends is key for a patient's quality of life.